replacements now. We went to a surgical seminar in California to learn about them. There's a variety of them now. Only one doctor I know of in town does them, and he's only done 2. And the reason is because we don't know the long term. We just don't know what happens, and so some of the more prominent doctors in town aren't doing them yet because we just don't know what happens in 10 or 15 years. Traditionally, surgically, they fuse them. I'm not a big fan of that. I just don't believe in it. It's a 50-50 shot. When you fuse one segment, you still have that torque, that physics, the pressure, the torque of living your life and moving around, the weight of your body. It's all still there. Well, this one segment's not moving, so all those forces go to the segment above, and it is so common for that disc to herniate. So now they got another, and then you can't even do conservative care as well because you're fused. You can't really be manipulated as well. You can't have traction. You're fused. And so your options are limited, and so now you're stuck in surgical world, and I don't like to see people go there.
Is there a time or a situation where you recommend to someone to have surgery? Is there a surgery that you feel like, yes, go do this? I can't give you what the surgery can do for you.
All the time. I have a good working relationship with surgeons in town. We both do, and spinal injections. I'm not against those things. I don't know.
What are you talking about, injections?
Well, sometimes
cortisone.
Sometimes you can inject narcotics. If someone is having a lot of spasm and a real hard time, injections can get them over that hump so I can work with them and get them well. I don't do that a lot, but I do. Surgery-wise, if they failed with the physical therapy we did, basically everything we did, the proper treatment, the protocols, you go through them all, and they still have, say, numbness in their leg and it's not going away with what we do, yeah, you need surgery. 80% of disc herniations, if we want to talk disc, do not require surgery. I'm guessing here, I would say 50% probably go into surgery, which means a lot of people are having surgeries and they don't need them. And they've come out with these long-term studies that have proven there's no advantage over surgery versus not having surgery in the long term for the majority of the people. There really is no advantage. But like I said, if there's a risk of permanency or it's affecting their job and they're not able to make money for their family and they weren't responding to what we were doing, I have surgeons that we work with surgeons in the area, and we just refer out.
For example, like your bowler. Say this guy was a professional bowler, and this is what he needs to do. Or a lot of masons and contractors that do a lot of lifting. What do you do with these people? Do you suggest they have surgery then?
If they don't respond. I don't like doctors that suggest surgery first just because it hurts. I just don't believe into that. There's always a risk with any surgery. Not every surgery is successful. You're not guaranteed to get well. So you want to avoid it as much as possible. But if you came in, say, for a month, 6 weeks, and you just weren't getting better, then you need to go up the rung of the ladder, so to speak. You need the next step. You need a little more severe treatment.
What do you say to people when they say, I always thought that this is a Band-Aid, it's not a cure. I want to be cured, so therefore maybe I do need to have the surgery rather than going through this because it's not going to cure the problem.
Well, I don't really think it's a cure to have, it'll take that disc that's herniated